Hello. Today I will be presenting my findings from my interview with counselor Brooke Coleman on treating people with PTSD. Post traumatic stress disorder is a severe mental health condition that can develop after a person has experienced or witnessed a traumatic event. Symptoms can include things like intrusive memories, avoidant behaviors, negative changes to their thinking and mood, and hyperarousal. They do have to have these PTSD symptoms for more than 1 month, and it does have to be impacting their daily life and functioning. So, holding a job, having a job, and relationship building. The World Health Organization states that around 70% or more of individuals globally will experience a traumatic event in their lifetime, and about 5.6% of those individuals will develop PTSD from their traumatic event or multiple. However, there's a lot of research that's indicating that it might be a lot higher than that, at about 10% of individuals globally that develop PTSD. The World Health Organization also states that up to 40% of people who do develop PTSD can recover actually within 1 year. And that's because there's a lot of highly effective evidence based treatments out there. I have indicated a lot of them on the screen. The ones that are with a star are actually strongly recommended by the American Psychological Association for PTSD treatment. One of those is CBT, of course, which is very thoroughly researched, and it does focus on the relationship of a client's thoughts, feelings, and behaviors. It focuses on changing their patterns and behaviors, thoughts and feelings that are leading to difficulties in functioning. CBT is used to help address their distorted thoughts and help develop healthy coping skills so that they can gradually confront their traumatic memories. TFCBT is one that I didn't really know about before this class and this interview, and it's an evidence based treatment that is specifically developed to treat people with trauma. It uses trauma specific strategies to help people with PTSD, and it was actually first developed for adolescents and children, so anyone 3 to 18 years. And because of that, it was paired with conjoined parent and or caregiver sessions with the child that has PTSD. And then another one that I learned about was prolonged exposure. It's a specific type of CBT as well that teaches an individual to gradually approach their trauma-related memories, including their feelings and emotions associated. It uses imaginal exposure, which is where a client repeatedly recounts their trauma in a safe space, usually with their counselor. They will gradually face situations, places, or things that they've previously avoided because they feel dangerous. But the goal is that when someone finally does face what they've been avoiding, gradually that a person's brain learns that the trauma-related memories are not dangerous anymore and they don't need to be avoided. Then another one that was good to learn about was EMDR, eye movement desensitization and reprocessing. This is a structured therapy that has someone briefly focus on their traumatic memory while also experiencing bilateral stimulation, which this is done usually through rapid eye movement, but also can be done through sounds or tapping. It's very people that I know who have done EMDR say that it's very intensive and overwhelming, especially in the beginning. And that was, I verified that with the research that I learned about. So yeah, those are the most common. And then in the next slide, I'm going to be talking about trauma-focused arts therapy and trauma arts narrative therapy. I interviewed Brooke Coleman. She's a licensed clinical social worker, and she's been fully licensed since 2004. She's been doing mental health counseling ever since, and she actually first got started at a community mental health program called Warwick Family Services. But right now, she's doing private practice through Grow Therapy and Spring Health. Both of those are platforms that help facilitate someone's private practice or support them in private practice. They get counselors in network with insurance. Grow Therapy is helping people get in network with most commercial plans, but it also includes some Medicaid and Medicare. And then Spring Health is primarily EAP. Brooke is enjoying private practice at both platforms, and she appreciates that she has help getting in network with insurance, and that she doesn't have to deal with that by herself. But with her private practice, she always makes sure that everyone signs an informed consent. She also has several measures, and it just depends on the person. If it's a trauma client or someone that specifically that has PTSD, she uses the PCL-5. She uses the impact of event scale, the child trauma screen, the Rosenberg self-esteem scale, and then of course she uses the CAPS-5. She also has used the PHQ-9, the GAD-7. She also uses the CSSRS, the Columbia Suicide Rating Scale. And then she really does specialize in trauma therapy for both children and adults. Her modalities that are most common are CBT, trauma focused CBT, trauma focused arts therapy, and trauma arts narrative therapy. Um, I didn't know anything about TFAT and TANT before this, but essentially TFAT encompasses various art techniques, so all different mediums to help individuals process and heal from their trauma. Usually, someone will create part of their traumatic memory during this therapy. And then TANT is very similar. Trauma arts narrative therapy is a structured, creative, cognitive exposure technique that specifically uses art to narrate the traumatic event. This technique can be used on all ages to reduce symptoms of PTSD, such as, say, flashbacks and somatic memories. But she primarily uses TANT for kids and TFAT for adults. But she says it can change depending on the client. And she also does a little bit of work with solutions focused and strengths based therapy, but that's not typically with her trauma clients. For ethical considerations, I did actually ask Brooke to go over the ACA Code of Ethics with me, and these were the 4 she pinpointed as being some that are relevant to her private practice. Personal values was a big one for her because she always wants to meet the client where they're at. She says that it's especially important for people who have trauma and are diagnosed with PTSD because they have to work through their trauma in their own time. She never wants to impose something on them, especially even art, but a lot of them end up being pretty receptive to trying art, even if they feel like they're not good at it. For multicultural diversity, she does have clients from a lot of different backgrounds, so she wants just to be sensitive on how she shares information with them, having an ongoing conversation with them about the therapeutic relationship. And then for responsibility to clients and responsibility to parents and legal guardians, she does make sure that guardians and caregivers understand the role that a counselor has in protecting the confidentiality of what her client shares with her. It is important that they know the dynamic in a counseling relationship. She wants to protect the client and wants them to feel safe to share things with her, but she also is aware that because they are a minor, their guardian may ask for information about their treatment at any time. So she just makes sure that, she's sensitive towards how she's conveying information to both parties, and that they both sign the informed consent. So the child or adolescent would, as well as their parent or guardian. We see the benefits of trauma-focused arts therapy and trauma arts narrative therapy in many ways. Some people have already tried to work through their trauma in a different modality, like EMDR, and it hasn't worked for them. But again, Brooke tries to meet the client where they're at. She likes trauma arts narrative therapy for some people because it does allow them to narrate the account of their story before, during, and after the traumatic event. And she says that for younger kids especially, this has been incredibly helpful because a lot of them don't have the words to describe what they're trying to say or what it is that they feel. But through art, they can start to. I think for many people, they love, she says they love the creative outlet that it provides them, because if they have been struggling to talk about their traumatic event in the past with other approaches to working through trauma, she says that art offers them a little bit of reprieve in the beginning, so that they can start to work up to feel more comfortable to talk about it after they've created a piece about it first. There is less evidence-based research for trauma-focused arts therapy and trauma arts narrative therapy. However, I did find a lot of great studies that support its efficacy. The first 2 studies I found supporting TFAT had 10 60-minute long sessions where participants aged 18 to 65 specifically used art therapy to process their trauma. They both found that TFAT intervention showed a clinically significant reduction in PTSD symptoms. The third study on trauma arts narrative therapy was selected because it was specifically on the validity of art therapy for children. The study found that children as young as 5 can benefit from TANT, and in the study, the children actually drew a safe point before the incident, after the incident, as well as the incident itself. The study found that there was a significant decrease in reduction of PTS symptoms like decreased mood and anger irritability from before treatment. And it also found that girls tended to report greater improvement than boys. In the fourth study, it was actually a meta-analysis for a trauma-focused CBT, and it found that there was large improvements across all outcomes from pre-treatment to post-12-month follow-up. For spiritual integration, I first thought of Genesis 1:27 as it mentions our Creator. God created our beautiful world and all that's in it and continues to create actively all the time. So I thought that it could remind clients and patients that they can be creators too and use their creativity to process their trauma throughout their sessions while they're healing. I then thought of Exodus 35:31-32 as it could remind the client that God instilled a lot of wonderful gifts within us. We can use our skills, intelligence, and knowledge to uniquely create new things on earth. God also gave us a lot of abundance in resources and materials to use to take creative liberty. And that made me think of Ecclesiastes 3:11 as it so beautifully reminds people that God makes things beautiful in its own time. People might feel like life is far from beautiful as they carry so much weight from the past and their traumatic experiences, but through art, they can start to begin to heal. They don't have to rush through art. They can take it day by day, work with their counselor, and use something beautiful that they've created to really be able to express their, feelings and emotions. And God wouldn't want them to not be able to enjoy life and find beauty in everyday life. So that's why therapy is so important, and having someone have creative liberty to really express themselves sometimes when words can't could be really impactful and empowering. It was a fun surprise to learn about art therapy through Brooke. I hadn't known about trauma-focused arts therapy and trauma narrative arts therapy before this interview, and I've always wanted to learn about how I could incorporate art someday with my own clients in counseling, and it was really enriching to hear about the positive impact it's had on some of Brooke's clients. I actually had a pretty severe eating disorder when I was a young adolescent and was hospitalized twice. I had severe anxiety and it manifested into an eating disorder, but I had two groups. One was when I was inpatient and one was outpatient, but they both incorporated some art into the group counseling sessions, and I found it to be really helpful. I think really more in introspection. I think at the time I was frustrated, but it actually did allow me to work through some of the things I was feeling when words weren't really enough. And overall, learning about these studies just really opened my eyes. I mean, in one of the trauma-focused arts therapy studies, they actually included some of the art, and I thought it was cool to see that some of it was 3D. So there was like these intricate 3D boxes that someone had created to represent their traumatic event, and it was really beautiful to see what they had created. Overall, I'm really excited to learn more and to maybe, one day myself incorporate some art therapeutic techniques. So I've enjoyed this presentation and learning more, and thank you so much. I know I was over time.